Hi class, my name is Nancy Gomez Fajardo, and today we'll be covering craniofacial anomalies, specifically hemifacial microsomia, also known as craniofacial microsomia. According to the National Institute of Dental and Craniofacial Research, this is, and I quote, the second most common facial birth defect after cleft lip and cleft palate, end quote. As for the table of contents, I'll be going through an overview of hemifacial microsomia. For the purposes of keeping it short, I'm going to abbreviate hemifacial microsomia to HFM. So whenever you hear HFM, it's in regards to the diagnosis that I'm currently speaking about. So again, going back to the table of contents, I'll be going through the anatomy affected, the speech impacted, and the treatment, so SOPs, responsibilities, and approaches. So to begin, an overview, hemifacial microsomia is a birth defect which affects the anatomical structures of the face. The structures are underdeveloped, whether on both sides of the face or one part of the face. There is a variability in which this condition can occur, but it usually causes a disproportionate anatomical face structure, not symmetrical. Some portions of the face can also be missing in extreme cases. According to the Department of Health and Human Services, HHS, diagnosis, and I quote, can sometimes be seen in an ultrasound during pregnancy, to where the doctor may order genetic testing if there are others in the family with features of HFM, end quote. Incidence and prevalence and cause. According to Bartlett and Taylor, it can range, and I quote, 1 in every 3,500 to 4,000 births, end quote, with the condition being non-progressive at first diagnosis. Just basically saying it's not going to get worse and it's not going to get better until surgery is completed or done. The causes are particularly unknown, with theories suggesting that the first stages of pregnancy, the fetus is lacking blood supply. The Department of HHS, Health and Human Services, suggests that, and I quote, having diabetes, taking certain medications, smoking, end quote, during pregnancy can cause HFM. Then again, these are just theories. There's not much information on how the anomaly is caused, neither genetically or on its own, or why there is a disruption in formation in the nervous system. So moving forward to the anatomy affected. As previously stated, the ears, mouth, lower jaw, facial nerves, eyes, and forehead are the common structures affected in hemifacial microsomia. But let's get into a little more detail for this slide. As you can see here in the picture, the child is diagnosed with HFM, specifically microtia, a condition that affects the outer ear development. In this case, the child's outer ear didn't fully form. Anotia, on the other hand, is when the ear is completely absent. So there's no ear canal or outer ear when a child is diagnosed with anotia. As for when the oral cavity is affected, that includes the mouth and lower jaw. The conditions that occurred are called mandibular hypoplasia and maxillary hypoplasia, in which the jaw is depressed and mandibular or overproduced and maxillary, influencing how the individual masticates, swallows, communicates, and breathes. Facial nerves will be covered in the next slide. As for eyes, the condition is called microphthalmia, in which the individual is born with small eyes that can lead to vision loss. Lastly, when the anatomy of the forehead is affected, usually there is a premature fusion of the structure that creates a flattened forehead that can affect the facial nerves of the individual. So moving forward, the reason as to why I wanted to give the facial nerves its own slide is due to the impact on the development of HFM and all the anatomies that HFM does affect, such as the ear, the jaw, the eyes, the forehead. The information that I gathered for this slide is from our book, in this class, SEQL, the National Library of Medicine, and Duke University of Medicine, where I gathered this photo from. According to NLM, the National Library of Medicine, the pharyngeal arches, also called the branchial or visceral arches, are the point of base in which the onset of hemifacial microsomia occurs, end quote. Recall that the cause of disruption in these nerves are unknown. However, the branchial arches are part of the classification of SVE, special visceral efferent cranial nerves. SEQL states SVE nerves are involved, and I quote, involved with the innervation of striated muscle of branchial arc origin, including the larynx, pharynx, soft palate, muscles of mastication. This in turn affects the special cranial nerves, such as the 5th, 7th, 9th, 10th, and 11th. So the 5th, trigeminal, is the sensation in the face, scalp, teeth, contraction of chewing muscles. Facial, the 7th, sense of taste, movement of facial muscles, secretion of saliva. Glossopharyngeal, the 9th cranial nerve, sense of taste, contraction of the pharynx. The vagus is the 10th, sensation and movement of the heart, lungs, etc. And accessory, which is the 11th cranial nerve, contraction of the neck and shoulder muscles. The reason why I'm giving a brief overview is because HFM affects these cranial nerves. As you can see here, I have a photo of an embryo here around 5 weeks. And if these nerves here don't fully develop, it will develop into a craniofacial anomaly, or CFA, or also HFM. It just depends on what nerves are fully affected, but HFM affects these nerves specifically. The nerves I just mentioned, the 5, 7, 9, 10, and 11 cranial nerves. Here is the head, the cranial nerves that are affected, and I'll go ahead and move on to the next slide. This is by SEQL. I gathered the information that I just stated in regards to the sensation, what the nerves are responsible for. In this photo right here, it just shows you the anatomy of where these nerves are responsible for, such as the facial, sense of taste. You can see that it's responsible for the front muscles here. But moving forward to speech impacted. So based on the information we have gathered from the previous two slides of anatomy and nerves affected, the speech impacted with individuals diagnosed with HFM can range from slight to severe communication difficulties. According to Bartlett and Taylor, respiratory support may be needed, or, and I quote, a tracheostomy if the jaw is severely deficient, end quote. The tracheostomy is a tube that goes through the neck, creating difficulty for the natural airflows of communication to occur. Recall that air must reach your vocal cords in order to produce phonemes or fluency, articulation, voice resonance. The respiratory system has a lot to do with the speech impacted. And so when someone is diagnosed with HFM and needs a tracheostomy, I do apologize, I'm probably not pronouncing that right, which is a tube that goes through the neck, it can affect all of these speech contexts. So I'm going to just give a few examples, just because I know I'm running out of time, but for fluency, the frontal lobe is responsible for the cranial nerves 9, 10, and 11, the glossopharyngeal, vagus, and accessory. These are the main nerves that HFM affects, and that is in the frontal lobe. Remember that the frontal lobe is responsible for fluency. And as for articulation, according to Siegel, the lips, mandible, tongue, and velum are of paramount importance in speech production. For example, the lower lips, and I quote, achieves a greater velocity and force than the upper lip and seem to do most of the work in lip closure. As you can see in the image, the child's lower jaw is disproportionate, affecting the anatomy and physiology of the lower lips, thus affecting articulation. Recall that articulation is in the Broca's area, which is also in the frontal lobe. So this is just all a snowball effect with individuals diagnosed with HFM. As I mentioned before, the hearing can be impacted, which also impacts speech and the way one communicates with another person. With microtia and anotia, the concept of understanding language occurs in the temporal lobe, where the facial nerve and the vestibular nerve, the 8th nerve, enter. Recall that the facial nerve is one of the main cranial nerves HFM affects during the 5th week of gestation. Jaw malformations can cause swallowing disorders, but also the way phonemes are articulated. HFM does affect the facial nerves, the 7th nerve, and the trigeminal nerves, the 5th nerves, which play an integral role in swallowing and located in the parietal lobe. So as you see here with this photo, I highlighted the different lobes and also the main cranial nerves that are affected. So as you can see here, Broca's area, Wernicke's area for understanding language. That's where the 7th and the 5th cranial nerve enter, and here's the 9th, 10th, and 11th. When any of those nerves are affected, it affects the anatomies or the responsibilities of what the frontal lobe is responsible for. So let's go ahead and move forward to the patient care and treatment. The SOP is going to enter a collaborative team approach when dealing with an individual diagnosed with HFM. Obviously, they will know about the surgical planning, 3D images. There will be a neonatal treatment program that the SOP will be a part of. The SOP's responsibility, I'll go ahead and put that there, is swallowing and feeding therapies, speech therapies, education, and training. So education and training will be for the patient and the parent. Speech therapies, according to ASHA, one of the following speech therapy is using phonetic placement techniques, typically starting with the bilabial and then moving to the alveolar. So we're just trying to get the patient comfortable with pronouncing these and just basically practicing phonetics with them after surgery. Swallowing and feeding therapies, this basically train the patient to be aware of the nerves and senses taking place. As I said before, HFM does affect the nerves. But that's pretty much all I have for today in regards to HFM. These are my resources, and credits to SlidesGo for creating the template that I used the template for this presentation. So thank you.